So after taking some time to reflect on the semester as far as coursework and clinical practice has been and kind of incorporating the two, I thought this class has really opened my eyes to a few things and kind of opened some doors to opportunities that I can start to implement. But I'll kind of get into that here in a little bit. Kind of starting off, I thought it was really helpful this semester with like the reflection videos we had to do about our evaluations with the ankle, knee, hip, and spine. I think the reflection about the spine was really beneficial because I know that's not really my strong suit as far as evaluations go, and I can do a spine evaluation, but it's, again, I'm not too confident with my skills in that regard. So it was really beneficial to see some gaps with that and, kind of work on them as the semester progressed. I haven't had too many patients with any injuries involving the spine, so those evaluations were kind of rare, but I try to take up the opportunity and challenge myself with that. But I going into those now in the future, I think I'll have a little bit more confidence just because I know that it's time to work on that and time to practice and make myself better. And then with the, just the whole comprehensive lower body evaluation, kind of reflection as well. Looking, if the injury is at the knee, you should look at the ankle and the hip. I've started to slowly do that, kind of like without thinking. That's really helped me a lot. As far as if range of motion, manual muscle testing, and special tests aren't really giving me any clues. I'll kind of like look into other areas of the body to see if I can find anything that kind of relates to what's going on or kind of helps, clue in what's going on. That's been very helpful, and it's something I've wanted to do since undergrad. I've had a few preceptors, that were really good at that and kind of went out of their way to be like, hey, yeah, you shouldn't just look at this one area. You should, make sure you're covering, the hip. If we're looking at the knee, make sure you look at the hip and the ankle. So kind of without thinking, I've noticed that I've started to do that, and I'm really happy we had an assignment over this, just because that just kind of reinforced me to think that way. The another thing I liked about this semester, as far as incorporating that into clinical practice, is, or not incorporating, but thinking about how I can implement this, especially with other domains of athletic training. So the telehealth or telemedicine assignment that me, Annette, and Kendall were in a group for, I thought it was really neat because, this can be done in basically any setting, really, whether it's high school, industrial setting, military. All you need is a video camera and Skype or Zoom or FaceTime or something like that, and you can do an evaluation. I thought it was really difficult, though, to do selective tissue testing. So, like, if it were at the knee, you can't have the patient do a Lockman's on themselves or an anterior drawer and know what that feels like. So I see some barriers with that, but as far as taking a history, getting some sort of objective data, as far as range of motion and having the patient maybe grade about how strong their quads are through a manual muscle test, that may be beneficial. But no, it's definitely an interesting concept that I think we'll start seeing more often here in the next 5 years or so, maybe even later. So yeah, no, I thought that was pretty interesting, and maybe something if it becomes more popular, I want to integrate. Another thing too is like the podcast I did with Tara and Elena. We kind of talked about the use of apps in clinical practice, and it's kind of unfortunate that there's a few apps out there that, especially for the ankle, I forget what it's called, but it basically shows interventions you can do. So as far as like strengthening and like kind of rehabilitative things you can do to get better. There's one app specifically, but I believe it's in Dutch, so I can't really use that, and I can't have patients go download that app because they don't know. I'm assuming they don't know Dutch. That's probably wrong of me to assume, but yeah, that would have been very beneficial. It's a free app too, so. Hopefully in the future we'll see kind of more integrative approaches as far as interventions in that regard. And then a couple other assignments I just want to relate to clinical practice that I kind of want to start doing. It's kind of harder with assignments and readings and staying on top of that. But creating diagnostic algorithms. That assignment was a beast, but looking back at it, I actually really enjoyed it. And it's kind of something I want to build off on and do that for more pathologies, injuries. Just a tool that I can have, and hopefully when I'm a preceptor one day, I can use those to kind of help educate students as well. And then the web of determinants, that assignment was a bear as well, but it really reinforced patient-centered care and the aspect of looking at social or economic aspects of a person's life and how farming can affect them and their dietary choices can affect their pathology and other aspects of their life. So I think all the assignments we've done so far have really reinforced and influenced things I want to integrate and implement into my own practice, and it's kind of get my wheels turning of maybe how I want to do that. So, thanks.